This 13-year-old patient was referred to me for endodontic treatment of tooth number 8. A few days ago, he had fallen off his bike and traumatized the tooth. Tooth was not fully avulsed, but it was partially, and it was even rotated. So he's taken to his dentist. His dentist rotates the tooth into position, pushes the tooth back up, and puts a splint on the tooth and adjacent teeth and referred the patient to us. So I always go over everything, of course, with the patient's parents, and here I went over everything with the patient's father. So I let patient's father know this tooth has a very guarded prognosis. So number 1, it can discolor. Number 2, it can become ankylosed. Number 3, inflammatory resorption can occur. So I go over all of that stuff with the parents and let them know that this tooth has a very guarded prognosis and needs to be monitored by the patient's general dentist. I'm an endodontist. Patient is welcome, the parents are welcome to bring the patient back to us, but they usually are seen more often at the general dentist's office than here. And some insurance companies don't allow the patient to come straight to a specialist. But I went over all of that with the patient's father, and patient's father wanted to try to see if tooth could be saved. Let me also show some x-rays, some pictures of the patient's condition, and I need to cover his face. So let me see what I can do to cover his face. All right, okay, let me put this somewhere. Let me see. I'm gonna turn this to here. You guys look at all of this for now. Let me all right, here it is. Take a look. So as you can see, part of the tooth broke, and tooth was also partially avulsed and rotated. As you can see, this was immediately after the accident. He fell off his bike. All right, so let me go here again. All right, and so he had also demophobia. So today we went ahead and IV sedated him and did the root canal for him. But take a look here. This was a 26mm number 40 file. So the working length was 25. As you can see, 26 is about a mil out. All right, so we adjusted it and went ahead and take a look. Did the root canal for him, apexification. Apical diameter turned out to be 50, so this is white MTA, got a perch and sealer, temporized the tooth, and refer the patient back to his dentist. His father will take him back to his dentist. But again, this tooth has all kinds of issues and needs to be monitored by the patient's general dentist. This is not decay, by the way. This is just the dentist repaired the tooth here. Remember, I showed you the clinical picture of the patient after the accident. That part of the tooth had broken, and this is the repair job by the general dentist. I don't know why it's not showing up on the x-ray, but this is not decay. This is just repair work. It looks like he used composite, but I don't know what kind of composite it is. That doesn't show on the x-ray. Anyways, but as I was saying, MTA plug here, got a perch and sealer, temporized the tooth, and the splint should come out now. It's been a week or two. Splint should come out. As I was working on the tooth, I noticed that the tooth has still some mobility to it. So I say maybe in a couple of weeks, the splint can be removed. But as I said, this tooth needs to be monitored. Discoloration, of course, it can be addressed by the patient's dentist. He can just bond some composite over the labial side of the tooth. But definitely ankylosis and inflammatory resorption can occur, and that's why the tooth needs to be monitored by the patient's general dentist. In case of ankylosis, that's a terrible thing that can happen because this patient is 13 years old, still growing. So that definitely needs to be addressed right away if the tooth is determined to be ankylosed. As far as inflammatory resorption goes, it really depends on how aggressive the inflammatory resorption is. Sometimes there is an inflammatory resorption that you can see, but you can see that it's very slow. This patient is 13 years old, so we don't want him to lose this tooth right now. We like to keep this tooth in his mouth for as long as possible without disease that can affect him. All right. So with inflammatory resorption, sometimes we can keep the tooth in the mouth for years before the tooth is deemed unhealthy and needs to be extracted. But as long as we can keep this tooth in his mouth until he stops growing, because at some point, if he loses the tooth, hopefully by then he has stopped growing and he's a good candidate for a dental implant. All right, but all of that, I wrote a detailed report to the patient's general dentist, and I went over all of that with patient's father as well. But as you can see, everything went great today.